Hello, everyone. Welcome to the April monthly meeting of the Youth Medical Career Exploration Organization. Today, I have the honor of meeting with Dr. Andrea Card, who specializes in internal medicine at Weill Cornell. So, thank you, Dr. Card, for joining us today.
Thank you. Thank you, Sahaladin, for having me and for inviting me to speak with the members of your organization this afternoon. Should I just launch in and tell you a little bit about myself and how I came to this career?
Yeah, for sure.
So I was born and raised in Belize, Central America. It's a very tiny country on the Caribbean coast of Central America. And the way our system was set up back then, when you get to high school, that's when they differentiate you based on your grades, whether or not you're going to take a science path or a business path. And so I was put in the science path. At that time, I don't really think I had any um intentionality about liking science or anything. It just seemed as, well, this is what you need to do, and so you do it, and then you end up actually liking it. It was probably my high school chemistry teacher that inspired me the most. She she taught us, but she was not as strict as the rest of the other teachers were, in the way of how she got us to learn. It was sort of a gentle, but firm hand in teaching us. And so that's, I think, if I think about why I started really, really paying attention and liking it and thinking about someone as a role model, it was her. And then of course I enjoyed my biology classes because that's when we got to do dissections, and I thought that was fun. It was more fun for me than something that I was plotting about what my next steps would be. Um, and then, of course, after you finish high school, you have to decide, yeah, you're going to go to college. What are you going to do? And I really went, by that time, my family had moved to the United States. We were living in Miami, and I was going to enroll at the state school that was located in Miami, Florida International University. And at that, when you get to choose a major, I had not thought about pre-med. I had not thought about being a doctor. I thought that that was like a long shot for me. Coming to this country, not being from here, and not having had my formal education begun in this country, I thought it was a really, really long shot because I didn't know better. And but I knew that I liked the sciences, and so I'm like, I'm just gonna do what I like. I like chemistry. This is what it is.
Okay, and on that note, so I know you mentioned chemistry and biology, but are there any like extracurricular activities that you would recommend students to get involved in?
Oh, I think the more you widen your likes and your experiences, the better informed you are as a human being.
Mhm.
And so if you can get involved with like book clubs, if you like dance and you like sports, because you're gonna learn, if you like those things, there's a discipline that comes with being involved in activities like that. If you like tutoring, do it. If you wanna be a guide at a summer camp, do it, because the wider you you make your basket of experiences, the the richer you are as a human being, and the richer your perspectives are as you're learning and you continue to grow no matter what you're going to do in life.
Sure, for sure. Okay, perfect.
Yeah, so then I did my undergrad, I did chemistry, I and I had wonderful teachers there as well. And then I started thinking about, what am I going to do now? How am I going to make this a career? And I was fortunate to be able to get a job in a toxicology lab in Miami right afterwards. So my path, as I'm saying this, you're going to realize that my path to medicine is not a linear one at all. Um, I got that job. and at that time when I got that job in the toxicology lab, because I said I like chemistry, I like being with my solutions, I make my stuff, I do my things. I'm just focused on that, no distractions. And I run my tests and I put out my results and I'm sure of them and I can turn them in and be confident that I've done a good job. Um, I was still not thinking about medicine. By this time, all my friends from high school, from Belize, some of them had gone off to medical school in Central America. Um, and they were telling me, why don't you come down, come here? Because all my friends thought that I would be a doctor. I just didn't think of it or acknowledge that. Even if it were in my subconscious, I did not acknowledge it at all. But all my friends, everyone who knew me from the time I was little will tell you that they thought that this was what I was going to do. Um, and then I was like, no, I live here. It's going to be hard. By then, I had known that if you study outside of the United States, the path back to working in the United States might be a little bit harder. I started having that kind of knowledge, but I still wasn't thinking about it. And then I don't know, out of the blue, I must have been working already like about 5 years in that toxicology lab that I decided, let me give it a shot. Let me see what happens if I try to apply to medical school. And so then I had been out of school for 5 years. I had to study. Um, and that's where I say if you are engaged in activities that help to reinforce the discipline that you develop as a student, that will help you because I had to rely on the discipline that I knew from my dance classes and for preparing for performances. I had to rely on that discipline that had become a memory of being in school and how to study on my own because I couldn't afford the study prep classes, even though I was working, I couldn't afford it because it just didn't fit. Plus, the salary wasn't enough, period, right? And so I had to pull on everything that I had in me to be able to study and be successful on my MCAT. And then when those scores came back, then I was like, oh, okay, this seems like this might work. But I still was not in the thought that I could apply wide. So I applied only to Florida schools because I knew that as a Florida resident, I would get some tuition subsidies for that. And and that in and of itself is really like casting just a very small net. And I was lucky that it worked out for me. But it worked out. And I started medical school at the University of Miami, completed that and then stayed there. While I was at the University of Miami, we get in the first year, at least during back then, the curriculum has changed quite significantly now. But back then, in the first year, pretty much in the first 2 years, it's all schoolwork, all like back lectures,
Mm.
straight up didactic formal lectures. And they gave us what they called a clinical preceptorship, which was a chance to go shadow a physician in the community who had volunteered to have medical students with them. And I shadowed this doctor who was a family medicine doctor, and I really liked him. And my friend from medical school was shadowing this other doctor, Dr. Nilda Soto, who was also a family medicine physician, but practicing out of a trailer. It was a free clinic that she had, and they used a trailer, an RV trailer that they converted to be a clinic. It was a free clinic in one of the southern cities of South Florida, Homestead, that so it's a free clinic. So there were migrant farm workers coming in there and then very low income people who lived in that area. And I went down for a toy drive one day and I met that we had done a toy drive and we took them some toys for the kids. And I met Dr. Soto and she was very generous. She said, "You want to come down? Come down whenever you have a chance." And when I went to her, and so I took her up on that offer and I started showing up on a Saturday at her free clinic that she was running. And the way she practiced was the way the doctors that I grew up with practiced. And that inspired me a lot. That was the kind of doctor that I wanted to be, a doctor who sat and listened to the patients, a doctor who um was able to find creative ways to make things work for the patients within what they had. And 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 that's what inspired me. And so then I was like, this is the kind of doctor that I want to be
Wow. And
when I finish.
yeah, and that was your first exposure to like a specific field, correct?
Yes,
Uh,
yes, yes. Because back home in Belize, because we didn't need specialists, so we went to the family doctor who was a general practitioner who was basically like a family physician. But also, if you needed an appendectomy, that would be the same person that operated on you. That's just the way it was. It's very different.
well,
Hmm.
nowadays, like how would you inspire and what advice would you have to current students that are like, undecided about what fields they want to actually go into? So, what advice would you give to those type of students?
I would give the advice that I would say is that if you're not so sure what you want to what kind of field you want to end up doing, it's okay.
Mm,
It's okay because when you get to medical school in particular, you're going to have opportunities to taste what I call taste. It now I can call it taste because I'm out of medical school. But while I was there, it was not. It was hard work, right? You get to go to different specialties. You get to do clerkships, and you get experiences with different specialties, and you can start seeing what you like and what you don't like. So how you can envision your life. If you're lucky, and you're fortunate before you get to medical school and you get connected with a doctor who tells you, yes, you can come and shadow me, then I would say take that opportunity because it gives you an idea of what the day-to-day life looks like. That is very different from what you imagine or what you see on TV or what you hear. If you don't see it in action, it's a very different life.
makes sense. Okay, thank you.
Yeah. So back to my story. So I'm in medical school and I have found Dr. Soto and I still have my preceptor who I still go to as well, my formal dedicated preceptor. And I go to Dr. Soto on my Saturdays whenever I have a chance or whenever I want to really, because she had an open door. And it started building this need for me, which has shaped my career. Even though back then I did not know it, my choice of a career is that and my focus is that I want to be able to take care of patients who are under-resourced, meaning underinsured or no insurance or language barriers, whatever that may be, patients who may be under-resourced and underserved, that I wanted to think about ways that we can make our healthcare delivery system work for everyone in this country. Um, because I was seeing that when I went to Dr. Soto's clinic, which in that trailer, I was seeing how you can make the system work for people that it may not work for, that it was not built for. And so I continued doing residency and did my scholarly work looking at uh a recidivism from the juvenile system and how that ties into poor health outcomes or poor health care access for. So I was always in that range, that sphere of my focus. And then that led me to do a fellowship, a health services fellowship after I finished my residency training. Um, and after my residency train, after that fellowship, I started working, and I have been able to work not as a researcher. I don't want to be a researcher. I never wanted to be a researcher. I I'm more of a teacher.
Yeah.
I'm an educator, and so I've been able to have jobs, including this one that I have here at Weill Cornell, that allows me to run a curriculum and devise that curriculum and revise that curriculum to help our residents think about all of our patients that we see, that the system is not meeting their all of their needs because they are under-resourced individuals.
Okay, thank you. And what can you say like a typical day in your job would be?
A typical day in my job is it depends. So most days will look like where I divide the time between me seeing patients for my own they are my patients, that my panel that I have developed, and then I would do that for half a day, and then that the other half of the day I supervise our internal medicine residents. So what that means is that the residents are seeing patients on their own, and then they discuss the cases with me. I will pop in to verify or confirm something in the case that the residents discussed with me, and then we come up with a plan. So it's a more of a supervision or a preceptorship for the residents. And then some days in the week, where I'm devoted to teaching, like on a Wednesday, I will spend my entire Wednesday morning teaching the internal medicine residents, and then Wednesday afternoon is what I have called administrative time. That is a time when I take to return phone calls from my patients, fill out their forms that they need, and take care of all of the administrative tasks that is involved in delivering healthcare to someone. And my Friday afternoons, sometimes I have administrative times that I use for meetings and for work to work on the curriculums that I develop, and sometimes I teach as well.
And what would you say is the most challenging aspect, like in the medical school world and in the medical sort of field that you weren't really aware of previously, and many students may not be aware of?
The enormous paperwork and bureaucratic factors that are part of the delivery of healthcare, especially for me as a primary care internal medicine doctor. There's so much paperwork, there's so much bureaucracy about how we're able to get patients what they need. And I don't think that anywhere in my medical school journey did I ever imagine that, or was that explicitly explained to me. That part would be the most challenging in that you as a physician, you're with your patient, you realize that your patient needs something, but because of challenges with being underinsured or or insured, but just the bureaucracy of being able having to challenge the insurer the insurances to say this is what the patient needs and please pay for this.
Yeah, that's perfect. And
Mhm.
for like the future and how current medicine is changing with obviously the implementation of AI, how do you think your field of internal medicine is like being adapted, and what should like young people be aware of for the future of medicine?
Mhm. So AI is definitely here to stay, and it's going to have a huge place in medicine. It depends on for me in my field, it depends on where we're looking at it. It can be a very helpful tool. It can be a very helpful tool in the sense of how if to cut down on that bureaucracy that I was and the administrative work that I was telling you about, if you can have an AI developed tool that pulls in the information for you, then you can see where your patients have gotten their care in the interim, right? Like in between visits, you send them for a test. They go for a test outside of the system, but still an AI tool will be able to pull that in. That's very helpful. It can cut down on your pre-charting time and also eliminate errors, right? Because everyone knows exactly what is happening. You know what is happening to the patient and can help and eliminate any kind of barriers or limitations to care. Where I think AI might be could be used as a negative for physicians is if if our insurers start using an AI algorithm to verify what we're billing. Not that that's bad, right? You need to confirm that people are billing appropriately. But if it does it in a way that leads to cost savings for the payer, the insurer, right? You can see how that could lead to or the possibility of less care or less services to the patient. So in that sense, I worry about how we use AI, and that when we're using AI and we are developing tools um, that that will be used in our healthcare delivery system, that it is really patient-centered, that
Yes.
the focus of the patient and what the patient needs will be at the center of that. It won't be cost savings too.
Insurance. Yeah, for sure.
Yes.
And
Mm-hmm.
just another question. This will be actually the last question. So I know you mentioned that you also do teaching as well. So I
Mm-hmm.
want to ask you, like, what are some career options like in healthcare that you might suggest to students that don't really want to step into to be a doctor or be necessarily in the medical room?
Mm-hmm. So healthcare is so vast. Um, Eve, there's so many ways you can take your career. So many health related careers exist, right? You can be a social worker, you can be a physical therapist, an occupational therapist, a speech language pathologist, or speech therapist. You can be a pharmacist. You can enter so many fields, nursing, so many fields. You can go public health. You can work industry in healthcare as well, right? You can go into the insurers, even though sometimes we as physicians we think of the insurers as the boogeymen, right? The bad guys. But you can go into that and lend that expertise, those lens, that healthcare training lens that you come to. If you come to medical school, and I think most people worry about the length of medical school, the 4 years, and then the additional training for your residency, and then to realize, you know what, this is not what I want. Or I don't see myself as seeing patients 5 days a week, 4 days a week, 3 days a week, whatever. That's how you don't see yourself that way. And I say that's also okay for you to come to that realization in the midst of it or after you've done it. It still gives you coming into the healthcare industry, whichever realm you take, gives you such a landing base from which to step off that you can have a plan A, plan B, plan C, and a plan D from it. You can pivot in so many different ways. You can teach, you can go straight up academia and teach. You can be a utilization manager. You can work for pharma, for the pharmaceutical industry, running studies or developing safety protocols for their products. You can go into public health. You can be a health as high up as a health commissioner, or you can develop public health and community-based practices uh, in liaison with community-based organizations. You can work for community-based organizations, lending that lens, that healthcare training lens that you have in developing their initiatives. That it's just a vast array of what you can do from this, no matter how you enter and what you decide on doing. You can there's always a pivot that you can do.
For sure. Well, that's all for you guys today. Thank you guys. Thank you, Dr. Andrea Card, for your wonderful advice. I'll be providing her email for you guys to reach out to her. And thank
Yes.